Hi, I'm Carlo Di Clemente. I'm a professor of psychology at UMBC and the director of the MD Quit Resource Center. It's a tobacco resource center for the state of Maryland. And I'm very happy to be part of this partnership between CVS Health and the Baltimore City Health Department. And they've joined together to really reduce smoking among the citizens of Baltimore, and most particularly among pregnant women and women with children, especially to kind of reduce exposure to second and third hand smoke, which ends up being pretty significant in terms of a risk for these children. So the importance of this is that there's a lot of illness related to tobacco exposure, and especially tobacco smoke exposure, and that together we can address this more effectively than either of us individually. So let's talk a little bit about active and passive tobacco smoke exposure. Active, if you think about the active tobacco smoke, there's what we call first-hand smoke, and that's the smoke that is inhaled by the smoker, creates the lung cancer, creates a lot of other kinds of issues for the individual over the course of their life. Tobacco smoke has been associated with numerous illnesses, not just cancers, cardiovascular illness, lung disease, and a lot of other kinds of things. And that's the smoker. But passive tobacco exposure is also very important. Secondhand smoke exposure is really the individual getting exposed through side stream smoke, through smoke that just comes off the cigarette, through exhaled smoke. And actually there's a significant exposure to the carcinogens related to tobacco in secondhand exposure. So that's a very important thing. It's especially important for children, and we'll talk a little more about that. What we're calling these days third-hand smoke exposure is really the particulates. So when you think about tobacco, and if any of you have ever kind of moved into an apartment where there have been smokers there before, or entered a cab where people have been smoking, you notice not only the smoke, but also there's particulates on furniture, on clothing, that really remain there for months and are very difficult to get rid of. And that's what we're calling third-hand exposure, and I'll talk a little more about that. Finally, there's nicotine poisoning. So getting exposed to nicotine, even if it's on your skin, ingesting it, it is poisonous. And we'll talk a little more about that too. So that's really the range of exposures that we're trying to eliminate with this program. In terms of the mothers who are smoking, it puts them at much greater risk for cardiovascular disease, for lung cancer. Actually, 90% of all lung cancers in the United States are connected to smoking. And premature death. There's estimates that it's about 14 years of life that are lost to smokers. So we need to be really aggressive in working with and trying to help people to quit smoking and to protect their children. So let me look at children now that we're talking about them. Tobacco exposure puts children at greater risk. Any amount of secondhand smoke is problematic. You know, it's a common asthma trigger. So lots of the ER visits for asthma are related to exposure to secondhand smoke. The third-hand smoke. Children are most vulnerable to the third-hand smoke because most of them are crawling on the floors, they're putting things in their mouth, they touch, and if you have particulates on any of those things, they're actually getting exposed to the nicotine and to the tobacco third-hand smoke particulates. The other thing is that nicotine ingestion. So every year the poison control hotline gets lots of calls from parents of children who have ingested. So they've taken a cigarette and they've eaten some of the cigarette. Or they've gotten some of the tobacco juice from an e-cigarette and they've used that, or they've accessed it, or they've drank it, or they've put it on their skin. So these are problematic, can cause diarrhea, vomiting, difficulty breathing, and even coma if they're exposed to enough of it. Smoking also has a lot of connections with problems in both pregnancy and postpartum period for pregnant women. There is low birth weight, preterm delivery, sudden infant death syndrome, increases in childhood respiratory illnesses, and even long-term effects on the child, cognitive effects and other kinds of effects in terms of their health and well-being in the long term. as well as they're living in a smoking home, and that also increases risk. So how can we join together and prevent passive tobacco exposure? Well, the best is really eliminating smoking from the home, making all of our children live in smoke-free homes, having people have smoking policies where people smoke outside. If you're going to be smoking in any space, you want it well ventilated. That's why we have people smoking outside of buildings these days and not inside buildings. And cleaning alone is not enough. There's been enough to look at. Even if you've got other apartments in the building where people are smoking, it gets into the apartments even of non-smokers. So you have to really be very meticulous in terms of making sure that you clean up all the particulates and really keeping the smoke and the smoking out of the household. With nicotine poisoning, the acute poisoning, you can absorb it through the skin or the eyes as well as through the mouth. You've got to be careful even if people are using nicotine patches, nicotine gum, because the nicotine for the young children is really a challenge to them and their health. So why are we focused so much on the pregnant women, and why are we focused so much on this early childhood? Because these are really teachable moments. You may find people coming in to talk to you about smoking. And so we have resources that we're providing to the CVS stores so that you can more easily connect them with information and connect them with resources that can help them. And we talk about these as teachable moments because people seem to be more open to being a little more motivated to do something about the smoking. You know, if they're protecting their child from asthma, there's a little more motivation to kind of say, no, we can't smoke in this house. Even to their husband or their spouse, you can't do that. So the idea is for you to take the opportunity, seize the opportunities that you have to really talk to these people and help them deal with this tobacco exposure and reduce the tobacco exposure. The wonderful news is that we've got a lot of resources. So there are medications, as you probably know since you distribute most of those medications in your pharmacies. So there's nicotine replacement. It's been wonderful. CVS has gotten rid of selling tobacco, but you also have access now to the resources for active tobacco users. Nicotine replacement is helpful. You have medications, anti-craving medications. And remember, both of these kinds of medications do not have the side effects or the problematic effects of combustible tobacco. Smoking and combustible tobacco smoke really has lots of gases, and that's really the most problematic part of the tobacco product. When we go to nicotine replacement, you know that there are many forms of nicotine replacement. You have both the gum, the lozenge, the patch, which are over the counter, and you have inhalers and nasal spray, which still require a doctor's prescription. So if people are coming to you for those kind of products, you can help them and turn them to some of the materials that you have now in the store that will support use of those products. Remember, highly dependent smokers may need more, so they need the 4 milligram dose, not the 2 milligram dose. And smokers often have experiences with these things. So some will say, well, I've already tried the patch. Sometimes they've done it properly, but many times they've kind of used it in an improper manner. So teaching them how to use these products or making sure they use them properly is also really critical. The cessation medications, both bupropion, which for smoking is really under the brand label Zyban, but is really also the same formulation as Wellbutrin, is an antidepressant with a lot of good properties to help smokers. Varenicline, or Chantix, is really an anti-craving medication for smokers that many smokers have found to be helpful. But you need prescriptions, and these should be done under the care of a physician so that they could also give them good advice and can check when there's any side effects that they need to kind of deal with. The other thing resources that we have is that, CVS has its own resources right in your store if you have a store that has a minute clinic. So basically all the CVS Minute Clinic folks have been trained to do smoking cessation. Also in the state of Maryland, you have access to quit lines. So if you have clients call 1-800-QUIT-NOW, and we've got cards that you can hand out that should be at your place that you can kind of give them. If they call 1-800-QUIT-NOW, they get confidential smoking cessation counseling or coaching. It's 24 hours a day, 7 days a week. So that resource is there. Or they could go on to smokingstopshere.com, which is a smoking website for smokers in Maryland, and they can access directly the quit line and other information at Smoking Stops Here. So if you call the quit line, what happens? So you should know about this. So if they call the quit line, they get an intake, but then they're switched over to a quit coach. And they can get up to 4 counseling calls, and they can also call at other times if they've got needs. Those counseling calls will prep them to kind of build a quit plan. It will also enable them to get access to, if they want it, nicotine replacement. So the quit line sends out free 12 weeks of patch or gum or both, depending on the quit coach's discussion with the particular smoker. There's also a number of other programs that they have. There's a website that smokers can access and do some exercises on. There's a text to quit program. So if they say, yeah, I would like to have texts me on the day of my quit and remind me to kind of stay off, they will put that program in effect and text the smoker if they request it. So there's a number of resources that you have at your fingertips if you call that 1-800-QUIT-NOW number. There are also some special programs that they have. So for pregnant women, that's especially important for this particular program, there's a 10-session protocol. So these women can call the quit line 10 times. Some of them, they are scheduled for before giving birth, and some of them in the postpartum period. And what's wonderful is right now, there's an incentive program. So if these women call and they make 3 calls as they're pregnant, they will get a gift card. And if they make a postpartum call, they will also get a gift card. So they can earn up to $90 by calling the quit line and participating in this program. And also currently, it used to be that you had to be 18 or older for the quit line. That's no longer true. You can access the quit line if you're 13 to 17. You will not get the NRT, but you will get the counselor calls and the quit counseling and coaching as they see fit. As I told you, the quit line also is run by the Department of Health and Mental Hygiene, and there is a website, smokingstopshere.com, that you can use and access for information, materials. Smokers can access it. They can connect directly to the quit line. So it's a wonderful resource. If you want to contact us, we have resources for providers. So we actually even have a page for the providers who are pharmacists. So it's mdquit.org. Baltimore City Behavioral Health Information and Referral Line is also available to you and to your clients. The phone number is 410-433-5175. And as you're noticing in your stores these days, you see a lot of resources that are available for you to use with consumers and customers who are coming in. So basically you have kiosks in your stores where you have information about healthy babies and how to quit smoking. You have some desktop kiosks. You have the quit line cards. So all of these things are to enhance your ability to reach smokers, to give them important information, and to connect them with the resources that can help them quit smoking. So I hope you'll join with us in this effort to reduce smoking among pregnant women and to reduce second and third hand smoke exposure among the children of the city of Baltimore. Thank you.